Good afternoon to all our viewers, and thank you for tuning in to today's COVID-19 update. My fellow Guyanese, initially, during the month of March, PAHO's analysis of expected COVID-19 cases in the region of the Americas showed that Guyana is likely to have 1,400 cases. In the month of April, a further analysis showed that if no measures were put in place, Guyana would have 20,000 cases. Hence, the stay-at-home advisory, among other measures, was instituted to flatten the curve. Today, 61 days after our first positive case, we are faced with a situation where over the weekend, we recorded 7 new cases. And today, we are reporting yet another 5 new cases, bringing the total number of new cases in just 3 days to 12, and the total number of confirmed cases to 109. In the last 24 hours, an additional 16 tests were done, bringing the total number of persons tested to 930, with 821 persons testing negative. Our COVID-19 deaths remain at 10. 36 persons have since recovered. There are 6 persons in our COVID-19 ICU, with 1 intubated and 63 in institutional isolation. Fellow Guyanese, we have constantly been pleading with you to come forward if you have been in contact with a positive case. We have also listed the areas where confirmed cases have been identified, but still, there is a reluctance for you to disclose your contacts. We must think seriously about flattening the curve and containing the spread of the virus so that we all can return to normalcy. Therefore, we ask you, yes, you, to put aside fear and stigma and do come forward and provide the information so that your loved one, your friend, or acquaintance can avoid the risk of contracting this disease and possibly losing their life. Now for today's global report. According to WHO's report dated the 10th of May 2020, there are 3,917,366 confirmed cases, with 274,361 deaths. In the region of the Americas, where Guyana, Brazil, and the US are a part, please note that during the last 24 hours, yes, I repeat, that during the last 24 hours, the number of confirmed cases has increased by 18,536, with the number of deaths increasing by 6,830. In Brazil, our very close neighbor to the southwest, the number of confirmed cases has increased by 10,222 in the last 24 hours. And deaths increased by 751. Today, yes, today, Among the 5 new cases, Upper Takatu Upper Essequibo, known as Region Number 9, is reporting its first case. Guyanese, a disaster is at our very back door. And unless we exercise caution and adhere to the control measures, the model figures of 1,400 and 20,000 can become a reality. Tomorrow, May 12, 2020, Guyana joins the rest of the world in celebrating International Day of the Nurses. I wish to invite our chief nurse, Miss Linda Johnson, to bring you greetings. Ms. Johnson.
Thank you, Minister Lawrence. Good day, fellow Guyanese. I am Ms. Linda Johnson, Chief Nursing Officer, Ministry of Public Health. Tomorrow, the world over, nurses are commemorating International Nurses Day, but within a less celebratory way. It is a day that marks the 200th birth anniversary of the icon of modern-day nursing, Florence Nightingale, also known as the Lady with the Lamp. But today, instead of celebrating, nurses are currently battling on the front line, doing all within their power to stop COVID-19 and save the lives of those that are affected. Today, we are grateful more than ever for all our nurses who continue to show commitment and resilience in this fight. Many of you have and continue to risk your life to safeguard us from COVID-19. You've traded your comfort, having to wear bodysuits and other pieces of protective equipment for several hours. Some of you are away from your families. You have moved out temporarily for fear of becoming infected and infecting your loved ones in the process. You are doing all of this for us and for your loved ones. So, you can show that you love and care for our nurses too by simply adhering to the advice of the Ministry of Public Health. You have a civil responsibility to stay at home if it is not necessary for you to get out. If you have to, then wear a mask. Practice physical distancing, regular hand washing, and other hygienic practices. To all nurses, I salute you on this marked occasion of our noble profession. I pray that God continues to strengthen and protect you as you continue to be soldiers waging the war on the coronavirus disease. I can assure you that your service is highly valued and appreciated. On behalf of the Office of Nursing and Midwifery and the Ministry of Public Health, a hearty thank you, nurses, for the exceptional job that you are doing every day. We are in solidarity with you. Protect yourself and stay safe. Thank you.
Thank you, Chief Nurse, for your charge to our nurses. My fellow Guyanese, we have to battle on all fronts. Central Georgetown, on our border with Brazil, in fact, in the entire country. So please, adhere to the curfew. Wear your mask. Observe your hand hygiene practices and stay safe. God bless us all. Thank you.